Hey there guys, Dr. Brandon Lee with you. So we want to talk about pneumonia today, and specifically pneumonia and vitamin D. Now, pneumonia falls into the category of respiratory tract infection. Often pneumonia is actually a result of a respiratory tract infection. And so at Immune Strong Families, you know we are committed to just helping the world understand that vitamin D is the immune system vitamin. And specifically, one of the areas that vitamin D really shines is in helping to prevent and fight respiratory tract infections. And so pneumonia falls right into that category. And so, specifically, an important thing to know is that pneumonia specifically refers to when the alveoli, the little sacs in your lung tissue, start to fill with fluid. And the alveoli are where the exchange of gases, of air, are supposed to happen in your lungs. And so if those alveoli are filled with fluid, it's going to reduce the capacity of the lungs to breathe, basically. So that's why pneumonia is so important. And so today I wanted to share with you three studies that look at pneumonia in respiratory tract infections and vitamin D. And so we'll go in chronological order. The first one was published back in 2010, and it looked at adults and their vitamin D levels. And this, they looked at specifically during the months of the year that people are most vulnerable for colds and flu. They found that people that had a vitamin D level of 38 nanograms per milliliter or higher actually had about a 50% reduction, or a 50% reduction in the risk of developing an infection. And in the people that still did have an infection but had a vitamin D level of 38 nanograms per milliliter or higher, they recovered faster. Okay. Now, as we look at these studies, keep in mind the optimal range for vitamin D is 40 to 60. Okay, so that last study we just looked at, they were looking at people who had a vitamin D level of 38 or higher. Really, that optimal range is 40 to 60, okay? This one was published in 2013, and they basically surveyed 17,000 adults, and they found that people who had a vitamin D level below 30 nanograms per milliliter were 56% more likely to develop an infection. Right? That's pretty incredible. Then this last one that we're going to look at in this video was actually published just in 2017 in the British Medical Journal. And they looked at 11,000 participants, and they were looking specifically at vitamin D supplementation and whether it helped prevent pneumonia and respiratory tract infections. And what they found is that especially in people who were dangerously low in vitamin D, had a vitamin D level of below 10 nanograms per milliliter or lower, and then started supplementing, those people who had a baseline super low vitamin D level, if they started supplementing, it actually reduced their risk of infection by 70%. Right? So those are some pretty astonishing numbers. And the reality is there is a lot of research about vitamin D and respiratory tract infections. For the sake of this video, we only looked at three, okay? So a couple questions come to mind. It's, do you know your vitamin D level? Well, go ahead and go to our website, immunestrongfamilies.com, and you can check out the Vitamin D Challenge to learn more about vitamin D levels and how to optimize yours. Another question for you, are you curious about, do you want to know more about vitamin D and how it supports and strengthens the immune system? We have a free mini masterclass at our website, immunestrongfamilies.com. Click on the link for the free mini masterclass, and it will go in depth and teach you a bunch of the science about how vitamin D supports immune system function. All right, I hope this has been helpful, and we'll see you soon.